Hello. I'm going to talk to you tonight about antipsychotic medication. Your doctor may prescribe this to you if you're exhibiting mental health symptoms or if you've been hospitalized. I have been hospitalized and put on extended leave, which basically gives them the power to make you take medicine against your will. You become what they call an involuntary patient, and if you don't take the medicine, they can come along and take you and make you go back into a hospital where, believe me, they will make you take the medicine. I've never tested their limits, but you don't want to. Anyway, I'll speak about the hospitalization and the difference between that and going in the loony bin, because there is a difference, in another video. Right now, I want to talk about the medicine and the many, many bad things that come with it. Now, let's assume that you've done very little wrong or nothing wrong, but you're exhibiting mental health symptoms. They will discharge you from the hospital and put you on extended leave. And they will give you a fairly high dosage. Depending on the medication you're given, it could be a number of things that they give you, because it's not all the same. Like, these medicines all have different levels and scales. I'm only familiar with the ones I've taken. The ones I've taken are risperidone, clopixyl, olanzapine, and what was the other one? Oh, Seroquel. Now, they all cause drowsiness, they all cause erectile dysfunction, they all cause hard to move the muscles, muscle stiffness. They cause blurred vision, weight gain, high cholesterol, high sugar in the blood, which could lead to diabetes. Long term, they can cause brain shrinkage, permanent erectile dysfunction, and impotence. And yeah, like I said, diabetes, high cholesterol, which increases your rate of heart attack, weight gain. And the longer you take these medicines, the worse it is for you. Because I'm not a particularly intelligent person as it is, and I really don't want my brain shrinking. I'm sure you have to be on this stuff for decades and at a higher dosage than I'm on. Because right now I'm actually on the minimal dosage, even though I've been taking medicine for 6 years now. 6 long years. It's rather unfair because I didn't do anything to deserve it. They just deemed me mentally unfit, and they keep putting this medicine in my body, and I don't like it. I'm really gonna grill my doctor when I see him next time. I don't like calling him my doctor. He's not my doctor. He's my psychiatrist. A doctor is looking out for your well-being. A psychiatrist is not. A psychiatrist is looking for another customer for big pharma. They don't care about you at all. Or else why would you be on this medicine for as long as they want you to be on it? Well, the trick to getting out of this never-ending trap of being on this medicine is to go along with it at first. You would lie through your teeth. You tell them you think the medicine's working, you feel comfortable, and you tell them very little about your personal life. Or if you do, tell them a pleasant story about it. Like, don't tell them anything bad about it. Don't tell them anything about maybe if you're addicted to alcohol, or you smoke a lot, or you like gambling. Try and tell them success stories, like you're at work, you're not going from job to job, you got one solid job that you have. They really like that. And don't tell them anything about conspiracy theories or thinking outside the box. They don't like that. They like to, when you have a circle, when you're thinking, they like to cut it into a square. So don't tell them anything about that sort of stuff. Just be very generic and vague with them. You can have the occasional drink, but just say, I drink socially, and that's it. And leave it at that. Keep it as simple as that. Just, they will try to push you. They will say, well, how often is social? How often do you drink? How often do you want to drink? How much do you drink when you do drink? But just be vague and specific and tell them maybe once or twice a week, whatever, stop asking me kind of thing. Because if you do drink or smoke, like I do, and you tell them this, it's not going to do you any favors. It really isn't. They're going to turn it into a problem and use it to doctor their evidence against you. So it's not worth letting them know anything. And especially don't let them know if you feel like self-harming or harming others or doing something of a violent nature. That will get you thrown back in the loony bin so fast. Not that I know from experience, but I have seen others say and do things, and it has not ended well for them. So anyway, getting back to how to get off this medicine as soon as fast as possible, which is what you want, is to just go along with it. Say, yes, it's helping, and be vague about it. Say, I feel better, I feel more comfortable, and they will take you off extended leave, and then you still got to take medicine though, but then they will switch you to a different form of medicine, less severe. They'll lower the dosage, and then eventually they'll discharge you from their care, and then you're free. It'll probably still be on your record, and it would be not that difficult for them to put it back on if you did become mentally unwell again and did something peculiar and someone noted that. But essentially, you're in the clear. They won't be watching you, they won't be doing anything, and you're free from their control. Because you got to get off this medicine as soon as possible, because it's doing you so much damage. I don't want to think about the damage it's done to me. I have gained a little bit of weight, but I have had blood tests done, and my sugar level has increased, and so has my cholesterol, all that which can be contributed to this medicine. And my vision's definitely worse. I'll have to find out if it actually gets any better when I am off this medicine. I don't know, so hopefully it does. Because actually my grandmother is going blind right now, not because she was on antipsychotics, but just because she's getting old. So since I'm genetically related to her, that could be happening to me in the future, and I don't want anything to make it worse, which this antipsychotic medication could do. So that's something to be concerned about. I certainly don't want erectile dysfunction. 40% of men get it anyway. Why have anything that it's going to make it more likely to happen? But doctors will say, or not doctors, why do I keep calling them doctors? The psychiatrists will say that they have deemed it that the risks don't outweigh the benefits. The benefits are better than the risks, therefore they don't care about the risks. They don't care at all about them. They wouldn't care about them anyway, because they're just sluts to big pharma. And I got no respect for psychiatrists, none at all. They sit in little group meetings and have little powwows, and they tour around hospitals, and they see you maybe once, twice a month. If they have high interest in you, they'll see you weekly. But they don't do much. They don't say much. They certainly don't tell you anything about what they actually think about you. Anything they do say, if they go, oh, we think you're an intelligent person, or, oh, you seem like a nice person, blah, blah, blah. They're just being vague and specific, and they're really assholes behind it. They're hiding behind a mask. And it just irritates me when they talk to me like that. Like, they don't care about my well-being at all. They just want me to be on this medicine and to be on it for a long time. I see my doctor on this Thursday, and I'm going to give him a piece of my mind, because I don't like the idea of my brain shrinking. I don't like the idea of getting permanent erectile dysfunction. I don't like the idea of my vision going. I don't like the idea of being drowsy all the time, because I am. Like, I cannot stay awake longer than 16 hours. I just go to sleep. I have no control over it. Coffee, energy drinks, they don't work. And this is me on the lowest dose possible. When I was on a higher dosage, I slept more than 8 hours. I'd sleep 10, 11 hours a day. And that's just not healthy. Oh, I forgot one other thing it can do. It can cause drug-induced Parkinson's. So, Parkinson's patients, 7% of them have taken antipsychotic medications. Now, that may not seem like a lot, but that's about 1 in 10 of them did. So it definitely says something about this medicine. So, yeah, just to try and sum up this video, you want to get off this medicine. First step is to get off extended leave. Go along with their program, say nothing negative. They'll take you off extended leave. Continue taking the medicine until they discharge you. And it should be peaches and cream after that. Because as soon as the attention's off you, keep a low profile and they'll lose interest eventually. I've never been discharged yet, so I don't know. I don't see an end to this problem, really. I'm sure it'll come about eventually, but don't let it bother you. Just keep a cool, calm, collective manner, cool as a cucumber, and it'll end much faster. Don't get panicky, don't get agitated. Just be calm and relaxed. And then you'll be off this stuff much faster. Anyway, hope someone learned something. Talk to you guys later. See ya.